Excellencies, dear colleagues and guests, on behalf of the Board of Directors of Charité Universitätsmedizin in Berlin, it's a pleasure for me to welcome you in Berlin and at this special site in Langenbeck-Virchow House, right across of the historic site of the Charité. While we meet in the city during a golden Indian summer, we should not forget that people around the world are struggling with their health care challenges in their own specific situation, which could not be recognized by us or would not be recognized by most of us. One of the big challenges to me, which will be addressed during this meeting, is the tremendous gaps and disparities in almost all aspects of healthcare between people, between regions, between countries, between sexes, between local people and migrants, and so on and so on. This is even more important topic for us because it does not urge so far the responsible people to take action enough to narrow all these gaps. I will give you only a few disturbing examples from our vicinity. The social map of this city proves there's a difference of nearly 10 years between the lifespan of people living in areas with a high mean income if compared to areas with the lowest income. This is not a unique finding for Berlin, but this is true for most of the metropolitan areas in the world. Nevertheless, it's still a challenge for people like me and you. While in big cities, healthcare workforce is expanding and seeking to extend their markets, there is in rural and depopulated areas a dramatic shrinking of the availability of doctors and healthcare services. In spite of thousands of doctors graduating each year from our medical faculties, there is a shortage of staff in small hospitals and GPs' offices outside the city. Of course, this example too is not unique for Germany, but it is existing in a number of other countries too. In wealthy Europe, due to the economic crisis, Greek hospitals can no longer afford medications for serious diseases as cancer or fungal infections, but by the politicians and our citizens, the economic crisis is only recognized as a problem of inefficient government. Some German hospitals are now hiring Spanish nurses to exploit the local situation, not considering that this will withdraw the best ones from patient care in their home country. The same applies to well-trained doctors from countries with lower incomes. By listening to my examples, most of you will have additional ones in your minds. This is a kind of remark which I like to attest to you to set a frame for this World Health Summit in which disparities play a big role. Nevertheless, I hope you will enjoy this meeting and the city, but I also hope you will add some progress to the burning issues of health in your home city, your home country, and to the society and around the world. Have an excellent meeting. I would now like to introduce my co-chair, Michael Clegg. He is the Dean of the Bloomberg School of Public Health of the Johns Hopkins University in Baltimore. And I have to admit I'm happy because he has also a nephrological background like me, and so we fit good together. Mike.